Welcome to Ask Syd, the official podcast for Sydenham Clinic. Today I come to you from our flagship location here in Beverly Hills. I am so thrilled to bring different guests onto the podcast so that we can talk more about our 7 pillars of health, and we can go deeper into your genomics, your gut health, your hormones, your sleep, your nutrition, psychology and physiology. So let's bring it on. Welcome back to Ask Syd, and as you can see, I'm in Beverly Hills, and today we have a very special guest, Dr. Shahin Ghadir. Welcome on our Sydenham podcast.
Thank you so much for having me. I'm very excited to be here today.
Well, we're honored, and if some of you know him from social media, you know he's one of the top fertility physicians here. He's double board certified, and we're going to talk all things longevity and all things fertility today. So, Dr. Ghadir, we really feel that one of the blueprints or like a biomarker for longevity is fertility. And how fertile you are or how healthy your sperms are or your eggs are sort of indicates overall health. Would you agree?
I would. I think that your fertility is a major representation on how your entire body is doing. But at the same time, there's a level of genetics that falls in there. So you can be the healthiest, always done all the right things, but that biological clock that females have, including how their longevity is and their fertility longevity, are sometimes not completely correlated. I do think that patients that we give the opportunity to learn about being the healthiest they can be also allows them to have the healthiest outcome with their fertility.
Right.
But those things have to be done really early on in life. Not when you're 38 years old and you want to have a baby at 39, I should be eating healthy this year.
No.
That's not the thing I'm talking about.
And that's why, we love the approach we take here at Sydenham, because we try and optimize our members. Like, we optimize their bodies so when they go for a fertility treatment, because increasingly now we're going to get into, how it's on the rise. But we've also noticed that some of our members have a little bit of a legacy mindset, right? Because they come from wealthy families, they want their legacy to go down. And how about like sperm banking or banking their kids' eggs? Just from a legacy point of view, what if something goes wrong? What if you have an accident? At least you should be able to have a baby. Like, even from that mindset. So a lot of our members, are open to those conversations. So we start with genomics. We start with genomics on all our members, and then we do the gut testing, the hormone balancing, and even teenage girls go through a lot of hormone imbalances, right? So I think it starts really young.
I think so too. And I'm always incredibly interested in doing everything people can do to increase their chances of being the healthiest. And starting early on with all of the testing that you guys are doing, I think is a very important thing. I would love to one day go over what your fertility panel is for the patients that are walking in here for preventive and care, and go over and optimize that, because I think it's important.
Absolutely. It really is. And it's also like the host, right? Like, inflammation is such an important factor.
Huge.
So we take it like the nutritionist would work with you.
People don't understand how much, like, for example, inflammation takes place and affects fertility.
Tell us more.
So it's a known fact in the world of fertility that as your weight goes up, your pregnancy and implantation and pregnancy rates go down. So the number one issue, for example, we have with obesity is the inflammation that goes on in someone's body as their body is getting more obese, because people don't really correlate those things together. They're not really correlating inflammation and weight. And we know that it goes hand in hand.
Absolutely.
So one of the challenges we have for people that are overweight in my practice is that, by giving them all of the injections that stimulate your hormones, it's really hard to lose weight.
It is.
But at the same time, those are the things that are keeping patients from getting pregnant when we put a perfect embryo in, when the inflammation takes over. So anti-inflammatory diets are words that come out of my mouth on a daily basis.
It's hard. It's hard to do it on your own.
Very.
That's why, like, our whole team gets involved. We know what your genetics are. We know why you're gaining weight. Like, by the way, I have every single fat gene you can think of. Like, I just genetically am I store fat. Or we'll come to know like what your detox pathways are. And we do like hormone testing. And when we come to know, what your cortisol awakening response is and why you're holding on to, stress can also lead to inflammation. So that's the beauty of what we do. But tell us a little bit about PCOS on the rise, because that's something that we feel like, it's like yeah, here, I don't have a daughter, but like I have friends, and every like third friend's daughter is struggling.
So I did my thesis in the area of PCOS over 20 years ago with one of the world's biggest experts in the field. It is a very challenging disorder that is not life-threatening, but incredibly annoying to treat.
It's
And
debilitating for some women.
it can be incredibly debilitating physically and mentally and emotionally. The fact that a healthy young woman starts to grow facial hair, can't have a regular period, doesn't ovulate, can't get pregnant, has stubborn weight gain that is uncontrollable and difficult to treat is very challenging. So the area of PCOS is one that I think is on the rise for multiple reasons. We are better at diagnosing it.
How do you diagnose it?
So there's different categories involved in polycystic ovary syndrome's diagnosis. The first thing that I like to explain to all of my patients that it's a major spectrum. So here in LA, I see people that like here would be normal and here are on the spectrum, versus in other parts of the world and in my past, I could see someone like a mile away at a mall and be like, that poor woman has PCOS.
Really?
Yeah. So, for example, the extreme on this end, someone you can see a mile away, obesity, facial hair everywhere, darkening of the skin around areas where we can see like the neck, but it happens under the arms, under the breasts, inside of the legs. These are all areas of the darkening of the skin is the first signal of insulin resistance.
Right.
So, the facial hair is the increased level of male hormone or androgens. The overweight is part of the whole insulin resistance part. The darkening of the skin is the insulin resistance part. So, all of these things you can easily observe in someone from a mile away. But the area that becomes much more challenging is when you have someone that is not overweight, who does not have the facial hair. In our Asian patients, none of them get the overweight or the excess facial hair,
Hmm.
and they could still have polycystic ovary syndrome. So it is different from ethnicity to ethnicity.
Hmm.
And at the same time, we treat it as a spectrum, and there are people that have it extreme and people that have it very mild. Um, for the purposes of getting pregnant, you could have it really mild, but it could affect your ovulation. So we look at ultrasounds and looks at the ovaries and sees if they look polycystic.
Hmm.
We look at anything that is elevated in the male hormone world, like testosterone, or signs of it, like the facial hair. And then the third is the irregular periods and anovulation or lack of ovulation.
Hmm.
So as long as you have two of those three major criteria,
Hmm.
it's very easy to diagnose. There are other subtle things that, like in the past, if your LH hormone was double your FSH hormone,
Hmm.
it was a clear diagnosis. Now, it's not part of the official diagnosis anymore, but if I ever see that, it gives me a big hint that that
Hmm.
patient may have PCOS.
So apart from the lifestyle changes and, the kind of stuff that we do here at Sydenham, what are some of the mainstream treatments, and are we moving the needle with all the AI and technology coming?
So I'm not sure if AI is affecting PCOS yet, but we have clearly seen that the use of injectable weight loss medications that
Yes.
help your insulin get work better, help you lose the weight, have been significantly important in this category.
Right.
The use of medications like metformin, which were around from the last 20 years that I've been doing this,
Hmm.
has been key because, for example, anything that gets your insulin to work better is going to help you recover and do better with your PCOS. So metformin helps your insulin work better. The GLP-1s make them work better. They affect the weight loss. We know that weight loss, 10% of your body weight lost already increases your insulin sensitivity and reduces PCOS.
So it's a very root cause approach.
Yes, there's no cure,
Yeah.
and you may suddenly start to ovulate, but nothing takes it away completely and says you don't have PCOS anymore.
What about endometriosis? Is that something that you encounter or work with, or?
I work with that a lot. And it is also from an underlying genetic issue that we are not sure why patients get it. But endometriosis, for people that may not know what it is the abnormal growth of the endometrial or inside of the uterus lining in places outside of the uterus. So, for example, when the lining of the uterus grows on the fallopian tubes, in the pelvic cavity, on the ovary, on your intestines, that is called endometriosis. It's a very painful disorder that every month when the lining of your uterus is getting really thick and you're ready to have your period, in the other parts of the body where it's abnormally growing, it also gets really thick and engorged and about to shed like you would a normal period and causes significant pain because on different organs and when it gets near nerves, it's excruciatingly painful. So endometriosis is also something that we treat with fertility treatments. There are really no like take a medicine and your endometriosis
Yeah.
goes away. But there are surgical approaches where it cleans out a lot of your endometriosis. There are medications where we can put you into a temporary menopause, and it keeps the estrogen levels, which are the fuel for endometriosis, really low. So it makes your endometriosis shrink and the symptoms go away. But both PCOS and endometriosis are two of the very prominent treatments needed for fertility patients.
And does endometriosis also have a lifestyle cure? Does
No,
balancing your hormones, living a better lifestyle help with that?
not
Or
really. No, unfortunately, no.
Mhm.
So
No
there's no
connection.
medication that you can take to make, it's not the root of it is not insulin resistance. The root of it is we have no idea where it comes from. After all these years in this industry, we still don't know. There are multiple theories of where you can get endometriosis from.
Mhm. Okay, so now let's get into the egg freezing world. It is becoming very popular and it's becoming very mainstream. Like back in the day, maybe like 25 years ago,
There was
the
no egg freezing.
like you hadn't heard. Now, all like my single friends, they made sure they freeze their eggs,
Of course.
right? It's like it's become a thing. So can you tell us more about it? Educate people who don't.
So it's one of my favorite topics because I think it makes a change in the future of the world. Women need to freeze their eggs because most women do not understand or are completely unaware of the fact that at the age of 26, 27, 28, they have a natural decline of their egg reserve and fertility that begins. Some people it starts earlier, some people it starts a little later, but those are the documented data that around 26 to 28 people's fertility declines. So I tell all my patients, and I have a loud voice on social media, so I want people to hear this loud and clear, that it is extremely important to consider to freeze your eggs, even if you have a 1% chance of wanting to have a baby. Many people in their 20s have a 0% talk about having a baby, and that percentage just keeps going up and up. And we see significant numbers of patients that at the age of 39 walk into my office and said, I never thought I wanted to have a kid, and now I want to make sure I can. And sometimes it's too late. So I tell patients that your 20s are your perfect time to freeze your eggs because that is when most egg donors donate their eggs to people. However, if you have turned 30 and you still have not either started or ended your family growth, and you haven't already frozen your eggs, that is my deadline to tell people at the age of 30. Now, if you didn't listen to me and you change your mind at 31 or
Mm.
later, it's still better to have some eggs frozen than no eggs frozen.
Right.
And the issue is, and the reason I say to do this earlier is because with time and with age, it gets less and less and less the quality of your eggs and the quantity of your eggs, both.
And also, I want to know how the whole process, but you're freezing them under like no pressure, right? You're just doing it as a preventive thing. You're like, okay, if and when I want babies, and if I can't have them naturally, at least I've banked my eggs.
Well, if you walk into the door at age of 41, there's a lot of pressure.
Oh, for sure.
So
But I'm
that
saying,
means you don't know about your quality of the eggs, you don't know how good they're gonna do, you don't know a million other things.
so I was
If
supporting
you do them at the right
freezing.
time,
Yeah.
and the right age, then you have helped yourself
Yeah.
with the idea that you take a lot of pressure off.
Right.
People also don't understand that you need a good number of eggs to make sure you get the successful family you want. So there are studies that have shown, for example, women that are 35 to 39 years of age, they need approximately 20 to 26 eggs to get a live birth. Now, I happen to think, for example, like my clinic is much better than the average clinic that was in the study. But still, I mean, I think that you need to have 15 eggs. And it depends from age to age. The younger you are, the less eggs you need. But these are things that are incredibly important. I have people that walk into my office and say, I want to have 4 kids no matter what.
So I want to go into the process now. And is AI impacting? Like, can you identify the quality of the eggs? Can we reduce this process? Like, tell us what a woman has to go through if she decides to freeze her eggs with you.
So the process of egg freezing is rather simple, simpler than most people think. You call us and you do a consultation, whether it's in person or virtual. And then we have you follow up the first day of your menstrual cycle. On the second day of your menstrual cycle, we bring you into the clinic. We do a quick ultrasound to make sure what your ovaries look like, how healthy they look, and you're not in the middle of ovulation. And then at that point, we are ready to start you on injectable medications that last for about 12 days on average, sometimes 10, sometimes a little more. We're the first clinic in America to have needle-free IVF.
Yes,
So
I'm
now,
hearing that. Tell us
yes,
more.
very similar to the insulin monitor that people put on the back of their arm, there's something that's much lighter and softer and weighs almost nothing that sticks on the abdominal wall, which is a port that allows a subcuticular injection to go directly into your body. So you leave this port on for 7 days, and after 7 days, we switch from one side of the abdomen to the other. All the injections that you're supposed to do into your skin with needles now go into a little tiny syringe. You connect the syringe with a little tube that's like 4 inches. You just inject it and it goes into your body.
Because that was one of the things that scared a lot of girls away. Like,
It
"I have
did.
to inject
First of all,
myself."
the needles are this tiny.
Yeah,
And if that scared you, you don't have to be scared anymore.
great.
And if you look at my social media page, I put it on myself
Uh-huh.
to feel it.
Right.
I barely felt anything, and the thing weighs almost nothing. So it's not like you're
For
walking
10
around.
days, 12 days?
It's usually about 2 weeks.
About,
About 2 weeks. We put it on one side, then we switch to the other side.
okay.
So the injections are about 10 to 12 days on average. And then you visit our office maybe 3 or 4 times during those 2 weeks to make sure that your eggs are growing. And basically, I say, you know what? You've done this for 12 days. Your eggs look like they're perfect sizes of follicles, we call them. And then you're ready to have a procedure that takes about 5 to 10 minutes in our surgery center under a light anesthetic, which is a sedation. You fall asleep. We place an ultrasound while you're asleep, which has a little tiny needle at the port. It goes through the vaginal wall and helps us retrieve all the different eggs that are growing on the ovary. They go through tubes into test tubes. We pass them to our IVF lab. And at that point, they are collected, counted, and then frozen in our IVF laboratory.
So
And
they don't go through any screening if they're healthy,
so you
unhealthy?
can't do that.
Not yet.
So there's no screening on an egg because the embryo, there's absolute screening.
Right.
But I tell patients, I say it's very difficult for me to tell you if your egg is a healthy baby or not, because I don't know if your future for sperm is going to be from a 20-year-old healthiest man in the world or an 80-year-old with 1 sperm. So it's very difficult to assess how well your embryo and your child is going to do by looking at your egg alone. Now, there are some things we could tell by looking at an egg, like if they look healthy, if they look very unhealthy, if they're dark, if they're small. We can tell some things by just general look, but that's about it.
Now let's talk about the men.
Sure.
So when do they start?
So research has shown that male sperm quality significantly goes down around the age of 40. Men will make sperm to the day that they're alive, but their sperm count goes down and their sperm quality goes down, and the risks of having abnormal embryos or abnormal pregnancies leading to miscarriage or abnormalities in the child all go up around 40. So we do a lot of sperm freezing as well for men, and the younger you do it, the better.
But you can do more analysis on the quality of the sperm versus
You
the
can
eggs?
do much more analysis on the quality of the sperm. You can first do a semen analysis, which gives you counts and quality. And we're also able to do a much deeper dive into the sperm, which is called sperm chromatin structure assay testing, which goes in, it kind of goes behind the scenes and tells us the DNA fragmentation quality of your sperm. So the healthier your sperm, the less DNA fragmentation there is. And we can do that for men as well.
So if a couple wants to freeze their embryo, what does that process look like?
So it's exactly the same as what the girl does to get her eggs out.
Mm-hmm.
The day that the eggs come out, on that day, we put the sperm and the egg together. The next day, we see how many of them fertilized and how many fertilized embryos we have. And then we watch those fertilized embryos grow for 5 to 7 days. At the end of the 7 days, we know how many of those embryos grow to the full grown stage, which is called a blastocyst.
Mhm.
Those embryos are biopsied and those embryos are frozen. And a week later, we get the biopsy results. Embryo 1, normal male. Embryo 2, normal female. Embryo 3, Down syndrome. Embryo 4, chromosomal abnormal. All the genetically healthy ones are then saved for the patient, and all the abnormal ones we discard.
And is there anything that's changing, or is there something
So
unique coming
there
out?
with that with the embryo creation, we have a lot of things that have changed. We now have special incubators that are called time-lapse incubators. They're able to take about 1,000 pictures a day as the embryo goes from 2, 4, 6, 8, and they're just growing and dividing. And then we take that technology, and we have now an AI tool called the Chloe at my clinic
Mhm.
that allows and analyzes every move of the embryo. So at the end of the week of growth, it also tells us which one of the embryos divided the healthiest manner possible.
Wow, so you could take a data-driven decision.
So we take a data driven decision on the structural well being of the embryo.
Mhm.
Then we take the genetic well being of it, and then we combine it, and then we can tell you which is your healthiest and best embryo.
That's incredible.
It's incredible for someone who does this at the right age that
Right.
has a lot of eggs and a lot of
Yeah.
embryos and can be picky and choosy. If you're doing this at an age where we're lucky if you even make one embryo that's
Right.
healthy, then you don't get to really use the benefits of all that data.
Well, our audience, but our members, they take a very preventive, proactive approach. So I'm sure they'd be very thrilled to learn that, they all these amazing advances that are taking place, and we already know their genomics, and they have their own genomics in place, and now they're seeing what's going on in the embryo. It's fascinating. Some of the psychological challenges, right? I mean, it's emotionally really hard uh, to go through an IVF treatment for some people.
Yes, it is. It is very emotionally taxing for many people. I'm always very grateful that I did my undergraduate studies in psychology because it allows me, and also I just think my personality allows me to communicate well and really be there for my patients.
Mhm.
One of the most important things that I've done in my career is always made sure that I had a very strong team around me. Because sometimes patients feel more comfortable opening up, for example, about something to my nurse and not to me.
Right.
So having an excellent team has allowed me to really be able to address everyone's psychological needs, emotional needs, but also I'm very present, for example, and I think that's important. I have been through IVF with my own wife. I have 4 kids. My first one was super easy. Our second one was super easy and ended in a miscarriage, and then we didn't get pregnant for 1.5 years. So we underwent IVF as well. I saw all of the challenges that happen in a young, healthy woman that my wife was undergoing. And then we had beautiful twins. At that time, it was very acceptable to put 2 embryos, and we were very interested in it. My twins are turning 14 in 2 days. So I'm very excited about that.
Congratulations.
Thank you. And then we're very fortunate that had a fourth as a surprise again. So all of the things that happened to my patients have happened in some way or another to me. And that emotional struggle that you go through is really important to be aware of, because having the right support system around you, having the access to get help emotionally is really important, and not everyone has that. So as their doctor and as the clinic and as a physician that is very involved, we make sure that we take care of our patients that way.
Do you think it helps if they come more like in a better like emotionally fit position, or there's never a right time?
Yes or and no. So if it means taking a year or 2 to put yourself together, no. Because then what did you do? You aged your eggs 2 more years.
Right.
If it means like this cycle, your grandmother died and you need a couple of weeks to grieve until next month and to be able to move on and be in a better headspace, that I'm okay with.
Right.
But not when I've had patients come and see me and come back 3 years later. "Oh, I just got really busy. I had this at work and I had that and this and that." I'm like, "That's okay. I'm here to help you, but you just aged your eggs 3 years." So, it's important to be emotionally stable, to have a support system, but if some of these things are gonna take months and months and years, you've
Right.
harmed yourself in different ways.
So your recommendation would be to just brave it out and
I love that word, brave it out. Because I always tell my patients,
Yeah.
if you're here to see me and you're going to do this, please just do it this coming period and be done with it. Because, and people have told me that's been the best advice I've ever given them.
Right.
If you're going to do it, you just got to take that step and do it and be done. And 99% of my patients, 99% afterwards have told me this was so much easier than I ever thought it was going to be.
What about the men? What's going on with their sperm quality? And,
So
men are going through their own
w-
challenges.
we have a major issue in the world.
Right.
So around the world, male sperm counts are down, male sperm quality is down. These are all things that have happened over the generational and environmental pollutants that we have brought into this world.
Mhm.
And that's why it's important to think about freezing your
Yeah.
sperm. You never know who's going to get a testicular cancer. You never know who's going to have an accident or what's going to happen. So I just think, in general speaking, for men and women, being precautionary and thinking ahead is really smart, especially for one of the biggest chapters of your life, which is
Yeah.
your family.
It's a big decision, and sometimes you may not think you want a child, like you said, and you grew up and you feel that vacuum and you're like, I want to create a family.
I've had many, many, many women walk in their late 30s, early 40s and said, I really never thought I want to have a kid. And now I realize I have to have a kid.
Right. Which brings me to my next section, surrogacy and, having a host mama.
So surrogacy is an incredible technology that has grown and grown. And we are very lucky. We live in a state like California that is open and it's legal. We have people coming from around the world to be able to do it here because it's illegal in other places. Um, if you have an inability to carry your pregnancy or a lack of even a desire to carry a pregnancy, that option is available now. And we help with that all the time.
Yeah, I think a woman has a right to choose. It's her body,
Of
right?
course. I've never judged someone that said, I just don't want to be pregnant.
Yeah.
And sometimes there's people that have to use a surrogate because they have no uterus or they have a problem with the uterus.
Mhm.
And also surrogacy has allowed us with the combination with egg donation for our gay couples to be able to have beautiful babies using both of their sperm or one individual sperm, putting it with an egg donor, then having a surrogate have that baby for them. So allowed many of our LGBTQ community to be able to have beautiful families
And for moms to be single moms. They're like, I
all the
needed
time,
that.
all the time. It's beautiful to be able to allow anyone who wants to have a family
Right.
to be able to do so.
Yeah. And I have friends who've done this, and it was the best decision of their life. They said, I didn't want a wife, but I do want to be a dad.
I've had that too.
Yeah.
I don't think I've ever had anyone come back ever sorry about one of those decisions.
No.
The other thing that I is a very difficult decision is using an egg donor. So for women whose their own egg no longer is viable,
Yeah.
it is past its peak and we just can't get a genetically healthy embryo, the use of an egg donor is probably the most challenging decision.
It's emotionally a very difficult decision to
Ex-
take, right?
Extremely, extremely. But those are also my most grateful patients. So
Yeah.
those are the people that are just the absolute most grateful,
Mhm.
who are the ones that told me, thank you, thank you, thank you for
Mhm.
helping me make this decision, helping, educating me, teaching me, pushing me, because it's a very difficult one
So you have these kind of conversations in your office all the time.
daily.
And there must be a lot of crying and sobbing, and the husband wants something else, the wife wants something else, and you're playing Cupid in the middle or you're playing therapist in the middle.
We do that all the time. And at the end of the day, the majority of our patients have excellent stories that we're very proud of.
Well, thank you for doing what you do. We want to spice things up by
Sure.
asking you a lot of questions, which are maybe on trend or not. And I just want you to say whether you think they're hot or they're not. So I think I already know my first answer, but egg freezing at 25,
Hot,
waiting until you're ready without testing.
not hot. What was the word that I was using for not hot?
Not hot,
Okay.
just not hot. Yeah,
Okay.
not freezing.
Okay.
We're not
Definitely not hot.
right. Oops, sorry. Okay, the next one, IVF as a first option.
Hot.
Why?
Because many people who are doing IVF as a first option are then collecting and creating embryos so they never have to worry about their other children when they get older. It is allowing them to genetically test embryos so that they know that the embryo going in them has already weeded out a lot of genetic abnormalities and miscarriage possibilities.
So you're saying that's a better option than naturally conceiving.
It depends. If you're starting naturally at the age of 22 and you want to have two kids, one at 23 and one at 25, you're going to be fine.
Right.
But if you are just got engaged at the age of, you know, 30 and you want to travel for a couple of years and have all that fun, but you want to have four kids, well, if you don't do something now, you're never going to have them.
Yeah. This at least gives you more freedom. It gives you more choices.
Yes. And options available.
Yeah. Calling 35 a geriatric pregnancy.
Not fun, but I don't make those titles. I think
But
35 is,
people do it like,
I mean, I think in hospitals, in textbooks, some of them still have that as a geriatric pregnancy.
ouch. So what's the oldest pregnancy that you've supported?
I had a patient who was in her 50s. She was like 51 and insisted. I sent her to every subspecialist possible to make sure she's healthy, from a cardiologist, internal medicine, EKGs, mammograms, pap smears, maternal fetal medicine specialists that are high risk OBs, everything she passed. And psychologically, she was okay. And guess what? She did amazing. She delivered her baby at her term.
And
And
it was a frozen embryo she had from.
no, she used an egg donor and a sperm donor, but she wanted to carry it and create it. And then she came back at the age of 53 for a second child.
And we did it?
She got pregnant both times, first time, and both times went to her due date without one complication. Now, am I a fan of that?
No.
Not at all.
No.
To me, it's way too risky.
Yeah.
But for her, it was incredibly, incredibly important, and she was willing to take all of the risks that potentially could be there.
Fertility testing for young girls. Like,
Very hot.
how young?
I think, once you're in your 20s, it's important to assess to see how fertile you are and then to follow it. So if you do it
What are
at
the
20,
tests that
there's
you do which
the
are
most
different from?
the most important blood test these days to assess your fertility is called an AMH, anti-Mullerian hormone. It is the hormone released from all the eggs in your body. The more eggs you have on this blood test, the higher the AMH level will be in the blood test. And that's an important way to kind of follow your pregnancy, your potential. So if you did it, in my opinion, in your 20s and kind of know what your number is, and you see, whoa, it's just kind of beginning to go down every couple of years, kind of wakes you up a little bit.
So that's it. And for boys, nothing.
No, I don't think this for men does anything. I think if you're in your 30s and you're going to try to conceive, a sperm analysis, but there's really nothing like that.
Is there anything else you'd like to share before we wind up? Anything on the rise? Anything that's a
I
trend?
think for women that are scared to know and they don't want to know, or they're just like, oh my God, I'm worried to know, knowledge is power. Knowing where your fertility is, I think, incredibly important in giving you options of what to do and what not to do. Talking to a fertility specialist doesn't harm you.
Yeah, that's interesting, because we're getting more proactive about our own health. We are taking our health in our control.
Absolutely.
And I think your fertility is your vitality.
I agree. I think it's a big part of your vitality and how well you're doing in life.
Or- Thank you. This has been, I think it's nice. It's opening up people's minds. It's getting them to think differently and unconventionally, which is going to become the new convention. But we'll stay tuned. If something new comes up, we'd love to have you back
Thank you.
and keep creating more babies and happy stories. Thank you for doing what you do.
Thank you so much for having me today.
Thank you for joining us on Ask Syd. Until next time, remember, health is by choice, not by chance. Thank you.